Okay, so what I'm going to do is I'm going to give you a little presentation on who we are, what we do, our background, and our benefits program. And then when we get to the end, leave it open for Q&A. If you have questions while we're going through this, by all means, ask the question. It's not a webinar, so we have it open for Q&A as we go through. Gabby, same with you. I mean, obviously you can't see the screen, but I'll get this over to you and you'll be able to go through it and go from there. Okay. I want to welcome. My name is Bernard Rubenstein. I am the Managing Director of Franchise Benefit Solutions. Providing quality, affordable employee benefits is one of the most critical issues facing the franchisee community today. By offering a benefits program, franchisees are better able to compete for and retain skilled and experienced employees. Many franchisees may not offer this important benefit. So over the next, let's say 15, 20 minutes, my goal is to provide you with facts about franchise benefit solutions, challenges facing franchisees today. We'll review our products and services, working with your franchisees, what our most popular benefit packages are, working with your prospective franchisees, any Q&A that you may have, and then what it would take moving forward. So some facts about franchise benefit solutions. With over 40 years of experience specializing in customized benefit programs to the franchise community, our firm provides exclusive plan designs to franchisees across the United States. Over the years, we've had the privilege of partnering with Authority Brands, Best Life Brands, Five Star Franchising, which is out of Utah, Velpac, Grocery Outlet, and the Joint Chiropractic, amongst others. In recent years, the insurance industry has witnessed many changes. Our clients are aware of the changes going on, and many have expressed an interest in offering alternative benefit plans to help recruit and retain employees. There are many challenges facing franchisees today. Here are a few challenges we hear facing franchisees today that relate to benefits. First, lack of benefits to attract new employees. In today's competitive job market, offering attractive benefits can be a key factor in attracting and retaining employees. Affordability of healthcare. Healthcare costs have been rising steadily, and franchisees may find it necessary or increasing challenges to afford healthcare coverage for their employees, impacting both recruitment and retention efforts. Limited back office knowledge. Many franchisees enter the business world from non-business backgrounds or from the corporate sector, where they may not have gained experience in areas like benefits administration. And finally, healthcare mandates. For franchisees with over 50 full-time employees, the Affordable Care Act mandates that they offer healthcare coverage to their employees or face penalties. We've been working with franchisees for many years. We have a solid understanding of the franchise industry, which allows us to focus on building a benefit strategy and developing long-term relationships. Our plans and rates are exclusive to your franchise network. Our plans and rates are the same no matter where your franchisees are located. If you have a franchise in Florida, Michigan, Washington, or California, our plans and rates are the same. We don't require employer participation or contribution. Plans can be employer paid, standalone, or packaged together through payroll deduction. We've optimized our enrollment process, which means less work for the franchise. We provide you with a branded page that would be linked to your corporate site outlining our products and services available. And finally, we would provide you with training and support for your prospective franchisees. Over the years, we've partnered with many franchise systems, and our list continues to grow. As you can see at the bottom right, literally, we enrolled, we're partnering with Ace Handyman, which is part of Ace Hardware, and then Miracle Ear, which we actually had a webinar with their franchisees end of last week. Our portfolio of products include medical, dental, vision, life insurance, accident, critical illness, hospital indemnity, telemedicine, prescription drugs, and short-term disability. Like I mentioned, plans can be employer paid, standalone, voluntary, or packaged together through convenient payroll deduction. Our benefits program includes 3 medical options: individual and family, comprehensive group, and voluntary group. For those franchisees that don't want to offer a group plan for their employees, but are looking for an individual health plan for themselves or their family, we offer an online quoting portal they can view at their own convenience. Basically, they put in their family information, their contact information, birth dates, and whatnot. And once they put that in, the portal program will outline from the lowest cost to the highest cost. They'll even show financial help or a subsidy that they may receive from the marketplace. They can view benefits at a glance, local providers, and they can even download enrollment form or apply online. Oops. If a franchise is considering their group plan options, we can help them make the right decision that best meets their healthcare needs of their business and their employees. Group plans are based on the demographics of their company, along with their employee and dependent ages. We would need census information in order to provide them with a group plan proposal. Our third and most popular option is our low-cost voluntary group medical plan, similar to an association health plan. Our plans are the perfect strategy for franchisees focused on cost containment, usable daily benefits, and compliance with the ACA mandates. Our WellCare plan includes preventative services only, while the Prime Care plan includes preventative services and limited primary care visits. Our most popular Elite Care plan covers preventative services, primary care, and specialist visits, along with urgent care, lab and x-ray services, and generic prescription drugs. Our IHP plans provides more comprehensive coverage, such as in and out of hospital, emergency room, maternity, home health care, chemical dependency, and prescription drugs. So basically, as you can see on the screen there, the WellCare covers physicals only. The average cost on that is about $55 to $60 a month. Our Prime Care is similar to the WellCare. However, it does include primary care visit at a $15 copay. The Elite Care includes primary care specialists, $15 copay, urgent care and lab and x-rays at a $50 copay, and prescription drugs at the bottom. IHP and the ISP Core and the Prime is more a comprehensive type program. The IHP is really a comprehensive program, covers inpatient, outpatient, diagnostic testing, prescription drugs. You can see on the left there's asterisks after the hospital facility services. What that means is benefits are subject to reference-based pricing, which means that if that hospital or the facility accepts Medicare, then they'll accept our program. We've had this program in place for 2 years, and we've not had one issue over the 2 years from any of the clients. So again, all our plans here are the same. Doesn't matter what state they're in. Rates are actually based on the class of the employees, not by the ages of the employees. which means that we have one rate for a single, one rate for employee spouse, one rate for employee children, and one rate for family. Any questions on this part of it so far?
I do. I have a couple of questions, Bernard. Thank you for this. I'm interested in seeing this voluntary group medical plans. This looks really interesting. Just to give you a little background, we've been doing Qsera plans is really all that we have offered, right, to some of our employees. But one thing that was a little bit confusing, so you said that the census information, right? You would need census information in order to quote rates.
Correct.
Um, and but then on the other hand, I thought I heard that the costs are, so are the costs different or the same for all of the franchises?
They are going to be generally the same. It's really going to be based on the area of the franchise. The well care, prime care, elite care, I can provide you with rates now because we have our own employer guide. The IHP
Mhm.
core and the prime are the same in all states. The rates are generally change on a quarterly basis, so they may change, but they're still going to be the same rates in whatever state they're going to be in. Does that make sense?
Yeah, I
So
kind of.
January, February, March, we're going to have
Uh-huh.
rates, let's say they're all going to be the same in all the states. Even though we still have to
Right.
send in a census, they will quote the rate to us, but it's going to be the same. Doesn't matter what state they're in.
Okay.
And then you have April, May, and June. It may increase because of the healthcare, but they're still going to be the same for those 3 months in whatever states that they're in. So the rates are
Okay.
going to be the same.
Okay. So the voluntary group medical plans, and forgive me for getting into the weeds in this, but I think this is pretty important. On the voluntary group medical plans, that's not the same as like minimum essential coverage, right? Through the Obamacare plans. These are different types of plans, or
Now,
are these the
remember
same?
that, so the well care, prime care, and elite care is the MEC plans, which is the
Okay.
minimum essential coverage. Those are the
Okay.
MEC plans. The IHP is more of a comprehensive, it's MV plans, the minimum value plans.
Okay. And then just also to, so I make sure I'm understanding this correctly, as a franchisor, right? We obviously we have our our FEIN number, right, that we work and operate under. But are all of our franchises, is the franchisor billed for these, or is each franchise billed individually?
Each franchisee is billed directly. And the reason I was
Okay.
pausing there is because you as the franchisor, and I actually have a list of questions at the end, which would answer what your questions are. But
Okay.
basically, you as the franchisor do not want to be involved with the franchisees. They make their own decision. They set up their own plan. You don't want to be involved with it because of liability reasons. So,
Perfect.
all the franchise logos that you saw there and a couple slides ago, not one of them are involved. Every one of them,
Okay.
we work with their franchisees, but the franchisor is not involved.
Then I'll just let you do your presentation and ask my questions at the end. Thank you so much. That
Yeah, 'cause
clarified a lot.
the Q&A may answer some of your questions anyway. So,
Okay. I'll
but
wait.
when it
Thank you.
comes to the medical plan here, each
Mhm.
employer, they decide how they want to set up the program because there may be an employer or franchisee that only wants to offer the prime care. They
Mhm.
may want to offer the IHP prime and contribute towards it where another one may not want to contribute. So each franchise, they have their budget. They may want to offer dental and vision where the other ones just offer medical. So each franchise decides what they want to do.
Perfect. Thank you.
Other services we offer, consolidated billing, online HR services, Section 125 premium only plan, and COBRA administration. So how do we work with the franchises? Our benefits enrollment platform includes 4 steps from the initial contact through the employee enrollment process: identifying the employer's objectives, reviewing their benefit options, provide a easy to understand benefits communication, and optimizing the enrollment process through our integrated portal. So as you can see on the screen, there's 4 steps. The first is working with the franchisee, identifying what their objectives are, because each franchise is going to have their own issues, what they're trying to do, determine their budget. Some may have a budget and some may say, I don't want to pay for any of the benefits and let the employees pay for it themselves. We'll gather information. Once we do that, if they're looking for a comprehensive program, we work with United Healthcare as our main carrier. And the reason we do that is because we have our own team of reps. We work directly through the corporate office out of Minnesota. We would then obtain quotes from them, present benefit options, and then formulate a benefits plan. So again, as you can see from the beginning, the first 2 is we work directly with the franchisee and identifying what they're trying to do and work through the process of gaining, providing them with their with information. Once they decide to move forward with us, we'll provide them with easy to understand communication, which they can distribute to their employees. It could be a benefits overview. It could be an employee guide, depending on the group and our schedule. We can conduct a benefits webinar. And while we're doing that, we would build out an online enrollment platform. Our online enrollment platform, we would, once we have all the plans and the group decides to move forward, we would input their plan information, send emails out to their employees. The employees would then log in, complete their profile, go through the enrollment process, and then we would work with the employer on payroll deduction on setting that up. Our carriers or our portal is integrated with the carrier, so it would go directly into the carrier, and then the plans would be set up for the group. So basically, once the employees are done, the employer has full access to our portal to see who's enrolled, who hasn't, who's partially gone through it, and if they have any questions, they work directly with us. A few slides ago, I mentioned the steps on working with franchisees from the initial contact through the enrollment process. Many franchisees ask us to help them set up a program which would help them hire and retain employees. We find that the 4 most popular packages that that most of the franchisees enroll in. First would be the employer offers our voluntary benefits at 100% employee pay. So the employer does not contribute at all. The advantage of this part of the program is that when it comes to the enrollment portal, the employees will only see what their benefit summary is, what their cost is. If an employer decides to contribute, they still won't see what the employer contributes. They will only see what they contribute. Excuse me. Package 2, the employer offers a dual voluntary medical and contributes toward the employee only cost. Then the employee contributes the balance of the employee cost plus dependent cost and any buyout. And then when it comes to the voluntary, the employee pays 100% dental, vision. And as you can see, all the 4 packages, the employee contributes 100% of the voluntary. The employer does not contribute at all. I would say out of all the groups we have, I'm not even sure we have a group that contributes towards the dental, vision, or any of the voluntary benefits. If they contribute, they only contribute to the medical and not the rest of the benefits. Package 3 Employer enrolls in a management-only group health plan through the special enrollment period, which is at the end of the year. It's a 30-day window. The employer would contribute 100% for themselves, management 50%. And then when it comes to the voluntary benefits, they would offer it to the non-management employees. Now, as you can see here on package 3, the employer is actually setting up a class of coverages, because they're setting up the class for ownership, class for management, and then class for non-management. So the employer decides how they want to set it up, if they want to contribute, and then we'll help them set up the rest of it. And then package 4 is employer enrolls in a comprehensive group health plan where they offer a dual medical option, and they contribute 50% of the employee costs of the lowest plan. Then the employee contributes the balance of the employee cost plus dependent cost and any buy-up. And then again, the voluntary 100% employee pay. So as you can see, there's different packages, but we find that most of the franchisees we work with, they will generally look at package 1, 2, or 3. When it comes to the comprehensive side of it, costs are really becoming unattainable for a lot of employers. So they're moving towards the package 1, 2, or 3. But package 1 is generally what we see, where the employer is offering all our benefits, where the employee contributes 100%. So we do go down to 1 employee. So if the group has, let's say, 10 employees and only 1 employee wants to enroll, we'll take that 1 employee. This is a franchise program, so it doesn't matter how many franchises or employees enroll, we'll go down to 1. Even if there's 1 employee that only wants dental, we'll take that group. Where a lot of carriers, they're going to want 5 or 10 employees, we'll go down to 1. Training for prospective franchisees. We often get asked from the franchisor to help educate prospective franchisees on offering benefits to their employees. Many prospective franchisees come from the corporate world and aren't trained on how to run a business. We will help you with educating your prospective franchisees with why they should offer benefits to their employees and help them set up a strategic benefits plan. In today's hiring market, a benefits package is essential for attracting and retaining top talent. Once franchisees have great employees on board, they want to keep them from jumping ship. So basically, we'll work with you on your prospective franchisees. So I know you had questions at the beginning here, but a lot of times franchisors don't have questions. So what we've done is, in working with franchisors, we've put together some questions. So I thought we'd throw them in here, and this might be some questions that you have, and then we'll answer them for you. First question, what if any liability is there to the franchisor? There is no liability to the franchisor. Once we are approved as a vendor partner, we will work directly with each franchisee. Second question, is there any cost to the franchisor? No, there is no cost. We would work directly with your franchisees. Does each franchisee set up their own benefits program? Yes, we work directly with each franchisee. Carriers require employers to provide their employer tax ID number, and I think that's what you were alluding to, your question. Do franchisees have to contribute? Nope. Plans are employer paid, standalone, voluntary packaged together through payroll deduction. Next question, how easy is it for franchisees to set up a program for their employees? Our sales and implementation team provides support and guidance tailored to the needs of each franchise to ensure successful implementation. What's the minimum number of employees a franchisee needs to start a program? One of the advantages of our program is that most carriers have participation and contribution requirements. We do not have those requirements. Can the program be started anytime during the year? Yes, it could. Now, our voluntary program is on a calendar year basis. So if they join in, let's say, May, then they're going to have a 7-month guarantee rate program. Our program, actually, we're in our second year of, let's say, this year's program where our rates remain the same. So our dental, vision, and our other benefits have remained the same. Second year, and I think we have another 2-year rate guarantee. I know our accident hospital benefits, I think we have a 4-year rate guarantee. Does Franchise Benefit Solutions work with recognized carriers? Yes, on a national basis, amongst other carriers, we work with United Healthcare, Blue Cross, Kaiser Permanente, Delta Dental, VSP, and MetLife. And finally, does Franchise Benefit Solutions provide reports on the number of enrolled franchises? Yes, upon request, we will provide you with quarterly report of initial contacts, their status, and enrolled franchisees. So, I mean, you probably have other questions, but these are generally the questions that we get moving forward. Our next steps is obviously you're going to discuss it amongst yourself. We do generally work with the franchisor. They generally have a advisory board where where franchisees are part of the advisory board. If you'd like, we could work with a few of your franchises to as if they're going to enroll in a program or at least review our program, and then they would report back to you, the franchisor, give you an idea what it's like to work with us. We would develop a program brochure, set up the branded page, and then we would put together a webinar for all your franchisees. And then once we do that, then we would work with each franchisee individually. So we're talking about a timeline about 2 to 4 weeks, but it's really up to you on the time status. So that's pretty much it. And again, here's my contact information.
Awesome.
I suppose you have other questions.
No, I mean, I feel like this was really informative for me. I have not gone down this route before where we've tried helping franchise partners rope in benefits. Kelly, do you have any questions or anything that's on your mind with this type of a program?
And I really love this. We've been looking for an option like this, and we've even worked with some HR companies to find a solution, and they have not been able to provide anything without minimums and that's easy to administer as far as franchisor is concerned. So far, everything looks so good, honestly.
I mean, we've been doing this. I've been in the business for over 40 years. We've been working with the franchise community probably since 83. I started working with trade associations and then moved over to the franchise community. Some of the names, I mean, have you heard of Joint Chiropractic?
I have not,
Velpac.
but
Everyone's heard of Velpac. How about you're in Utah? How about 5-Star Franchising?
No.
I've heard of that.
Yeah,
I've heard of 5-Star.
yeah,
That's
Salt Lake.
home services, right? That's 5-Star.
Correct.
Yes.
And then Authority Brands, which is the same as them.
Yes. I guess I was just looking in the wrong places, so I'm thrilled to see this, honestly, because really we've never had a trained HR department at Keyrenter because we've just been such a small business. And a lot of we do have kind of a large international team. And I recognize that, are there any benefits for an international team that you're aware of?
Each country's going to have their own
Right.
system on how they treat healthcare.
Mhm.
We're asked quite a bit of late, Canada. We do have a colleague, and I'm in Detroit, so I mean, I'm right next to Canada. And we do have a colleague that in Canada that can work with you. I mean, Canada has their own healthcare system, government system, so theirs is a little different. Um, each country is going to be different. We don't work on an international basis. Ours is US only based, but we do have access for international healthcare when a US citizen leaves the US, and they visit a different country. So that type of coverage we can provide you, but if someone is, one of your franchises isn't in another country, that is totally different.
And on the census, is that our responsibility originally, right? Of getting the census for the franchisees that want to work with us, or would we just provide you with that information and you would work directly with them?
You don't even need to be involved at all. What we do is if a franchisee is looking for a comprehensive plan, we
Mhm.
send them the census form because I mean that's gonna be more of, in the HIPAA privacy
Right.
sectors. So we would work directly with the franchisee. You don't want to be involved.
Okay, perfect. So that's just really about enrollment and obtaining that initial information.
Yeah, we use that information to obtain the quote from the insurance carrier. And then
Mhm.
once we receive it, then we work directly with the franchisee.
Okay. And then on some of these voluntary things, are those portable? If an employee left, could they take that policy or
Yes.
not?
Okay, very good question. Yes.
Okay. Well, I asked because I'm old. And is there a maximum benefit age?
Uh, as long as they're an active employee,
Mhm.
for the life insurance, I think it's age 70 or 75. Um,
Mhm.
the employee can purchase life insurance on themselves, their spouse, and their dependents. I think it's up to 150,000 without any health questions.
Oh, okay. I love this. I think it's a great alternative, and I think it's something that we really need.
It is, I mean, we exhibit at the IFA. I don't know if you're familiar with
Mhm.
the IFA, but we work with the IFA. We're a uh, partner with them on offering
Mhm.
benefits. I know I don't even have the logo in there, but we um, we exhibit at their trade shows. We've,
Right.
I think, this past about 3, 4 weeks ago, we had about 35, 40 franchise systems that came to us while we were there looking for a benefit program for their franchisees.
That's great. I really like it.
So
Gabby,
I was gonna,
Gabby, are you available to talk? I know you've been
Oh,
driving.
she's off the call, I think.
Had to hop off. Okay.
Yeah.
Well, I really like it. Gabby's in charge, and I think it would be fantastic to have this recording. I work closely with Joseph. He's our controller, and I know he's been looking for something. I actually was doing compliance with Keyrenter from franchise perspective, but honestly, when it comes to HR, I know nothing about it except for, common sense things and how to research the regulations, so this is fantastic. You said that you do have an HR department if we needed for referral?
Yeah, yes, and you're asking the question on, I'm trying to
Gee.
understand your question there.
Yeah, so I was just saying from an HR perspective, if the individual franchisees had questions, they could come to you and you could provide a referral, or you would do that directly?
If they have question, now referrals in regards to,
Just legal questions, or I guess there really wouldn't be any once the package gets sets up. I was just wondering, like, if they wanted to quit the program or something like that. It's just normal.
so when it comes to, now that's another good question when it comes to, let's say, the webinar for the franchisees.
Mhm.
Being that our online enrollment portal, they can terminate employees off the portal, and if they decide that they want to leave our program, they could do it through that, or they would reach out to us. We have a lot of franchisees that actually, I mean, their employees are gonna have questions, they have questions, so we do have a um admin team that will work with them. And, you know, the one question, I mean, there are some questions that we can't answer because of HIPAA, that they would
Mhm.
work directly with the carrier. And then if they're not able to, get a satisfied question answered, then we could
Mhm.
work with the carrier, but then we would probably need something from the franchisee or specifically that employee in order to work with the carrier. But, you know, compliance, you understand that, and when it comes to HIPAA, there's only a certain amount of information that we have access to, or we really what we can answer.
Okay, that's great. That they could work directly with you guys, and
Oh, yeah,
that's fantastic.
definitely, definitely. Well, what I could do, what I will do is I will send this recording over to uh Gabby, I think. Do I have the email of the of both you, Kelly? And
I can throw our
Um,
emails in the chat here if that helps.
yeah,
what's that? I'm sorry.
Oh, I was just gonna say my email is ann@keyrenter.com and I just put it in the chat. Kelly is going to be the same, just Kelly@Keyrenter and then Gabby@Keyrenter.
Okay. Sounds good. So I will get this over to you, and then I will work with Gabby on moving to the next step. Again, just a quick reminder, how many franchisees do you have?
I think we've got
We
like
have
62 or 58 or 62 open right now, with about 6 in onboarding.
Okay, and then what's the average number of employees per franchise?
I don't know if we have that metric.
Yeah, that's because, especially because we do have a lot of international virtual assistants. So the number of employees, I would say it's honestly, I would say 5, or in some offices, maybe 10 to 15 maximum.
Oh,
But on a happy note, each office is growing. We're doing very, very well.
that's
But it
good.
is small, right? They're small business offices, definitely.
Well, you know what? That fits right into our realm of the
Mhm.
number of employees that we work with. For instance, joint chiropractic, obviously, um, chiropractic offices, they average no more than 5 per office. And then we work with grocery stores, or mainly out in California out west, but they have 25, 30. But we rarely have franchisees that have over 50 employees. If they do, it's because they have more than one franchise that they own. So
Oh,
our niche is probably 10 to 15.
this just brings up another question. Because, we're in real estate industry, a lot of times they have independent contractors that are working for them as sales associates, right? Because of the professional licensing requirements. Can they provide options to independent contractors, or do they have to be W-2 employees?
Have you heard of First Choice Brokers?
First choice brokers. I don't.
They're out of Vegas. We just picked them up a couple of weeks ago.
Uh-huh.
We met them at the IFA. They're, I think they're like 80-90% of their employees are 1099. And
Uh-huh.
to answer your question is we would need at least one. Now, this is for the comprehensive program. We're talking like the United Healthcare. We would have to have
Okay.
one W-2 employee
Uh-huh.
in order to enroll 1099 employees. Now,
Okay.
on our
Because
voluntary program, we'll take 1099 because we're working with the employer. We don't ask for any documentation. So to us, a 1099 employee is the same as a W-2 employee.
That's music to my ears. I honestly, I guess I just haven't been to enough Fran Dev conferences to run into you guys because that's fantastic.
Have you
I
seen,
didn't even know that was
have you
possible.
heard of the new ruling on the 1099 employees? Because I think in the last couple of weeks, there was a new ruling, government ruling on 1099 employees.
Probably not. What is the new ruling?
I
What is
didn't
that?
really pay attention to it, but you know what? I can look through we get emails from IFA.
Uh-huh.
I can have it sent over to you.
That would be fantastic. I know they've done a lot of things with Homeland Security and they've, changed a lot of things recently and tried to get more transparent and even just reviewing documents. It's been really interesting. And I don't know really anything about HR. So it's fantastic that you guys are here and able to offer some benefits to our franchisees.
Well, I'm happy to hear that. If you have any questions on moving forward, I'm here to help you. Like I said, I'll get the recording out to you. I'll also try to find the article or articles that I've been seeing lately on the 1099 employees. I'm writing it down.
Okay, that would be perfect because I don't think we have any offices with over 50 employees. Do you think, Anne? Do we have any offices with 50? No. That might be a while before we get to that point. Honestly, I think one of our goals is to never get to that point, to be able to operate without that many.
Well, the thing is, it's a lot more, if they have more than 50 employees, it's a lot more IRS
Yeah.
mandates and a lot more compliance
Mhm.
reporting where when I work with the grocery stores and a lot of them do. And once they realize the reporting, I've had some that actually went under 50 just because they didn't want to get involved with the mandates.
I can understand why, honestly.
So
It is a whole different world, isn't it? When you're a larger, I guess that's still considered a small employer, but to us, it's not.
yeah, well, once they hit 100, then it's a large employer, but
Right.
50 above,
Uh-huh.
they have to offer health insurance or they're open for a penalty.
Right. Okay, I do have one last question. If we were offering a QSERA plan and we wanted to back out of that and offer this, could that be done in the middle of the year or does that have to be done at year end? Do you know the answer to that?
No, it can be done anytime during the year from
Okay.
current plan to one of our plans. And the reason is the plan you have now, you can terminate anytime. It's the rate guarantee is generally for 12 months. But when it
I see.
comes to the the actual policy, you can terminate anytime. Is it a self-funded type program or is it a,
No, no, it's through minimum essential coverage through the healthcare.gov. So we just will reimburse the premiums up to a certain dollar amount. But the problem is a lot of our franchises or a lot of our employees, they might get insurance through their spouse, and then it doesn't meet the qualifications for Keyrenter. So they're not included in that plan. And that's one of the things that we didn't like about the Keyrenter plan that we are offering. So we're
How
trying to
many-
make it a little more fair across the board.
I get it. How many employees are on the program?
There's only 5, if
Okay.
that. And 2 didn't qualify because their spouse. The IRS looks at it like they've already taken that tax deduction, or their spouse has, because the premium was pre-tax dollars. So they thought, well, they're already getting that advantage. So through their other employer. So I don't know. It's very strange.
It's totally up to you how you want to set up your program. What's the your policy date?
Our policy, well, we don't offer the plan. They just go through the Obamacare plans or the healthcare.gov, which I think it was right at open enrollment, started in October or something, and then it ends, and then they extended the enrollment date. So I couldn't tell you.
So
But I
basically,
was,
no, I get it. So basically, you're just, how much are you contributing?
so it was mostly about, we were only contributing like $200 per an individual, or $300 per family if they're purchasing their own plan through healthcare.gov. So, right, if they have to purchase insurance on their own. So
Did they
it's
had to,
expensive.
yep, did they have to provide you with the receipt on a monthly basis, or how did they?
So we were using a company called Take Command, and they were an administrator, and we had to self-administrate. So every individual goes in and uploads their policy information, and then Take Command decides whether or not it qualifies based on the IRS ruling. And then some of the people didn't qualify. And I'm already on Medicare insurance. I finally hit that golden age, that's what I got to look forward to. And so that created a problem for me. I don't know. It's difficult because I have to update it constantly, like quarterly. It's
Well,
really it's a pain. I don't like it. So I think it really comes down to how easy this is to administer, really. And if it seems like it looks easy if you just provide a link, and then the franchisees or appoint a person to administer their plan each individually, that would be fantastic.
that's the way it works with it. By the way, I just hit the Medicare age myself. So
Well, it's certainly better than the alternative, isn't it?
you got that right. Definitely.
Yes.
So
One last question. So if we pick multiple plans, right, if we created a plan, because this has been challenging, let's say would each franchise get a separate bill for like dental, vision, life insurance? Are they all through different companies, and they would just get 4 separate bills based on that enrollment? But the enrollment would be the same for the entire plan.
it
Is
would be,
that,
the
oh no,
enrollment would be the same. The invoice, they get one invoice for all the benefits.
per month?
Yes. So most of the
Okay.
benefits that we offer other than medical is through MetLife.
Mm-hmm.
MetLife and Delta. But the medical, it depends on the plan program that the franchisee is looking for. But
Mm-hmm.
it's interesting as you're talking about your current setup. We just
Mm-hmm.
enrolled a Miracle Ear group that
Uh-huh.
had the same program that you did, where they were I think theirs was also $200 that they would allow for the employees, but the employees would have to go into, I don't know if it's the same company you have, and provide them with the info on the Obamacare or the
Mhm.
marketplace, but
Right.
the employer had no knowledge of what the employees purchased, what plan they had, or anything about it.
Well, and that's okay, as long as it's verified, right? As long as it's verified by somebody, third party, we don't want to get into the personal lives, the individuals, as long as there's a process for making sure that everything is verified, I
Exactly,
guess.
exactly. Do you have
That's
do you pay a administrative charge for that too?
we do. It's pretty small, but once you put somebody on for the year, it's continues for the rest of the
Yes.
year, even if
Right.
you let them go. Is that
That's
the
what,
same?
yeah, that's what's good about the payroll deduction, because generally, once the employer goes in there and sets their payroll deduction, it's generally gonna be
Mhm.
the same for the remainder of the year.
Oh, right. Yeah, that's good. So you just offer the election at the once a year and that's it, just like you have an open enrollment,
Exactly
which
what it
should
is.
which should okay.
The other thing too that we offer or provide is, let's say there's a group that their payroll vendor is ADP.
Mhm.
Could have ADP and our enrollment portal linked. So that way they don't have to get involved once they uh enroll the employee, let's say under payroll with ADP, then it would automatically integrate with our enrollment platform or vice versa. So if there's a change, it would integrate with ADP and then our enrollment platform.
So we use OnPay, and I don't know, is ADP, is that integrated to OnPay or is that a separate platform?
That would be separate.
That's a separate platform. Okay.
ADP is the payroll vendor.
Okay.
Payroll, yeah, so I don't know, the way your benefits are set up would be, that's not your payroll company, that's just a benefits administrator, right?
Yeah, so OnPay is just where all of the money is calculated, and then it does send, I think, it does do the automatic payroll deduction is there, and that's where everything is calculated. It's probably just different than ADP, and it's called OnPay.
Right, right. So the company that I was mentioning that had the same setup as you did, they actually
Mhm.
went with the IHP plan.
Uh-huh.
Um, that way they were able to enroll the employees and have the administration like what I explained how the program works. So they got away from the program that like what you have now.
Right, through the QSERA. That's
Correct.
good.
Yes,
Okay. Well, this is good. So the MetLife also goes into more information too, because you're connected with MetLife,
correct. We're
correct?
connected or dental,
Okay.
vision, life. That's all with MetLife.
Okay. Well, this has been very helpful. Thank you so much, Bernard. Appreciate it.
Okay, I'll get the info out to you, the recording. And if there's any questions, let me know.
Yeah, thank
Thank you.
Okay, okay. Have a good day.
Bye.
Bye bye.